You received research funding from the Department of Defense once for one of your projects. Can I ask you what that's for, or is that classified?
Yeah, it's not classified. The Department of Defense, is one of the biggest insurers of men and women in the country, and so they've invested in cancer research. I work with patients with prostate cancer, so it's a disease of aging. So these men are looking for new therapies. So in the last 7 years, I think we'd have 8 new drugs for prostate cancer that extend survival, most of them with a relatively reasonable quality of life. So I think folks are sort of living longer, living better, and again, for me, making this really a chronic disease, so that even when I'm caring for them, I get to know them, I get to grow older with them. So it's a process that really is rewarding when I'm working with these individuals.
When first meeting your patients, you don't first jump to the history of present illness. Why is it important to get to know your patient personally first?
Yeah, I think, I think patients with cancer come in being vulnerable. They're coming into a building that says cancer center, they're meeting a cancer doctor, so there's a lot of emotion around that. And again, trying to make them feel that they're not the disease. And so that's one of the first things. And it really was in my training that sort of I felt I took better stories from patients by sort of, doing all the other stuff, finding out about their family or their medicine. When I'm thinking about planning a therapy, if I know they live alone, that's going to take me a different path. If they have a big support system, what does that mean? If they're caring for somebody else who has medical issues. So that is important information as I hear their story. Sometimes it frustrates patients because they're so used to the medical community sort of saying, why are you here, what can we do? Or many doctors have already gone through the whole chart, made assumptions based on what other people have said. And my sense is I really try not to know what other people have said so that I can sort of offer my opinion. That is a part of my assessment, what other people have said, but it's not what I start with.
I noticed a little samurai helmet sort of thing on top of I think that's a Wayne State mug. What's that all about?
When I was 15, I was an exchange student to Japan. They sent me to rural Japan.
Sure.
And I was with this family, and the relationship that I had with them changed my life. Taught me a lot about nonverbal communication. I didn't speak Japanese, they didn't speak English, but I was there, immersed in this family. And I got really close to my Japanese mother. And when I left Japan in 1977, I told her that I would come back when I got married. So I kept that promise. My wife and I showed up, went to their house. They said that when we had our first child, they would come. So they were here, and that's when she presented me with the samurai hat. And then they actually died in the tsunami of 2011.
Okay.
So it's been very hard, and sort of it's just a memory of all that she brought to my life.
Dr. Carducci, thank you so much for your time.
Sure.
That was a CLOSLER Look.
Okay, thanks.